Well, hello and welcome. I'm Susan Weinstein. I'm Executive Director at Families for Depression Awareness. We are a national nonprofit, and we help families cope with depression and bipolar disorder to get people well and prevent suicides. We like to say that we help caregivers get their families on the path to mental wellness. Please do visit us at our website, familyaware.org, where you will find tons of resources. But I'm not going to take up a lot of time with that now. I just want to thank you so much for joining us, for doing an expert interview today on creating a supportive environment for families affected by PTSD, post-traumatic stress disorder. I am thrilled to be talking today with Támara Hill. She's a licensed clinical child and family therapist, and she's internationally board-certified trauma therapist. She specializes in treating children, adolescents, and families who suffer from mood disorders, unresolved trauma, and disruptive behavioral disorders. She also provides international consultations and works with young and older adults who are struggling with grief and loss or life transitions. She strives to help clients to realize and actualize their strengths in their home environments. This is important. And in their relationships within the community. She is internationally recognized for corresponding literary works, as well as appearances on radio and other media platforms. She has the fastest growing psychology channel on YouTube on family trauma. She is an international and keynote speaker, family consultant, and founder of Anchored Child and Family Counseling in Pittsburgh, Pennsylvania. Welcome, Támara. All right, so let's start with this. Can you please define family trauma and discuss how it's different from PTSD? What are the key characteristics and symptoms that caregivers should be aware of?
Yeah, absolutely. Family trauma is complex. It's very different than individual trauma and vicarious trauma, which is a kind of trauma that you witness. You witness somebody else going through something, and what they have gone through is very traumatizing. That's vicarious trauma. So family trauma entails a variety of dynamics. One dynamic is figuring out how one family member or two family members or more have impacted individuals within that family. So individuals within a family dynamic would be sister, brother, mom, dad, sister, brother. Sometimes extended family, like a cousin or a niece or a nephew. They can all be in this family dynamic, but each of them have different kinds of trauma. So let's say, for example, we're coming from, a military family. Dad has been overseas for 2 years. That can be traumatizing, just being separated from family and possibly being in combat. Then we have mom. She could have some form of acute or chronic PTSD or some kind of chronic stress just because of having her husband overseas and raising children. The daughter, the son, or the sister, the brother, they can also have trauma because they don't see dad. They're observing the struggle with mom, and maybe they're being bullied in school. Maybe there's some other factors in that family that is impacting the children. So now we have a family unit that has individual trauma, and together, collectively, they have family trauma. And the dynamics of that unit can be really difficult. In private practice, I see a family now who's a military family, and there is a variety of dynamics. I often feel when they come in to see me like I'm working with individuals because they think very differently. Their traumas are different. But when we get into the meat of why they feel traumatized and what their thoughts and feelings are, now I'm working with the entire dynamic as family trauma. And it can be traumatizing for the provider or, for the parents, just to watch the dynamics and discuss the issues that are in that family. PTSD, I also want to mention too, because the question here is, can you define family trauma? I want to mention that family trauma is different from PTSD. Family trauma, again, is a collective kind of a trauma. So you may not see symptoms of post-traumatic stress disorder. PTSD has two important components. One is there has to be some kind of traumatic experience that has impacted you, and you had absolutely no coping skills to manage it. Something hits your family, you weren't ready for it. Something hits you individually, you weren't ready for it. A fatal car accident, somebody dies, a family member, you weren't ready for that. And you didn't have the coping skills to manage that pain and that grief and that loss. So there has to be a traumatic experience. The other thing with PTSD is you're going to see re-experiencing symptoms. So that would be flashbacks, that would be nightmares, that would be feeling like you're back in the situation that has traumatized you. You also have to have avoidance. So the human heart and mind, it avoids the very thing that has caused PTSD. So there may be a lot of avoiding driving because of the fatal car accident. Maybe you can't listen to music in the car. It has to be down really low so that you can pay extra attention. Maybe you avoid cars altogether. Maybe you avoid buses and Ubers because it all reminds you of the trauma. So there has to be a traumatic experience. There has to be re-experiencing. There also has to be avoidance. And then most likely you're going to have the other component, which is arousal. So you're going to feel like you're in fight or flight mode. You're going to feel like your stress hormones are high, which means your endorphins are kicking in, and you are ready to either escape an environment that triggers you, or you're willing to stay put and deal with it. But you may walk away feeling really exhausted and overwhelmed because now you just put up your dukes, and you were trying to fight back all of these symptoms of PTSD. So you have to have that. We also have in PTSD, and this is important, depersonalization and derealization. So both of those things are pieces of dissociation. And dissociation is a kind of pulling away from reality, meaning, it's hard to stay present psychologically in the moment. So your mind automatically escapes. It says, you know what, I can't do this. I check out. I feel like I am now walking in a dream. I feel like nothing is real around me. I feel like I have been watching myself perform my daily duties. That is depersonalization. Derealization is similar, but the only difference here is you're you don't feel like you're in a dream. You're in reality, but you kind of feel floaty and not really present and foggy. And you're kind of, in a sense, it's like a severe form of daydreaming. You can't snap back to what's going on in the present moment because your mind, your brain is going through a process that is separating it from reality. So those are, in a nutshell, the symptoms of PTSD that we need to clinically classify an individual with PTSD. Family trauma is a bigger concept, a broader concept, and you don't necessarily have to be diagnosed with PTSD.
Okay, thank you so much for that. I'm going to ask you to please take a moment to talk about what you mean when you say a person lacks the coping skills with regard to a traumatic experience. I'm afraid that some of our listeners might misconstrue that. And then can you also talk about, we know that creating a supportive home environment is particularly important for people living with PTSD, something that they can, we want them to be able to count on that. So can you talk about how does the physical and emotional space affect their recovery?
Yes, absolutely. I think maybe I want to clarify, just because I think it's important to be non-judgmental as much as possible when talking about trauma. And the awesome team here, they're very clearly wanting to distinguish between what's a personal slight and what is just something that happens to most of us, and it's hard to manage. Earlier, when I said trauma is interesting because trauma is defined differently in different contexts. But earlier, when I said that sometimes a traumatic experience can happen, and sometimes we don't have the coping skills to manage it or to face it, I think it's important for me to just highlight and clarify that trauma doesn't hit us all the same. It has a very different way that it impacts each of us. And sometimes we don't have the skills or the tools available, but it has very little to do with character, personality, life experience. It has more to do with just at that time feeling very unprepared for what that trauma has presented us with. So as we go along in this discussion, I want to make it clear as we go along that not having the tools and resources is very normal, which is why therapy is important, or creating that supportive environment for an individual so that they clearly understand that this is a situation that has kind of caught you off guard. It's making you feel a little overwhelmed, and it's not anything that you should look at as, well, why can't I get over this? Why can't I get better? It really is a neurological and physiological experience. Without that safe environment, fight or flight mode continues to happen. The body continues to run like a never-ending engine. And the mind can feel very much like a mind of ADHD, where there's a lot of inattention, restlessness, confusion. There's a lot of poor concentration, sometimes irritability. A lot of times, individual trauma that's having an impact on the brain, it can trigger hormones. Cortisol, which is a stress hormone, it can trigger that. Just being in a chaotic environment or being in a school that's just triggering all the way around, it can trigger a mind-body connection that is hard to undo. And so the trauma continues to cause the family trouble, and that is not a good thing. The higher our cortisol levels and the longer fight or flight continues to operate like an engine, the body and the brain shuts down. And it's really hard to get people who are traumatized or feeling triggered or overwhelmed, it's hard to get them to talk. It's hard to get them to process. It's hard to get them to have a good night's sleep that's refreshing. It's also really hard to get them to focus on everyday life and to remain engaged, because they want to escape that unsupportive and unhealthy and triggering environment.
All right, now, let me ask you this. What are the key elements to successful trauma healing, and how can caregivers observe progress in their loved one's PTSD recovery?
What are some things that we can do to make the environment supportive and safe? Really, and this is what I have, my clients kind of process when they come in to see me and they have family trauma and individual trauma. You want to consider the things that we would never consider as being a trigger for most people. When trauma has impacted you in a family, when trauma has impacted someone individually, it's important to look around your home environment and say, or ask yourself, are there things in this environment that could either make symptoms worse or better? Are there things in the environment that can really trigger me or my family member in a way that isn't healthy? And if so, making those adjustments are important. What I usually suggest to my clients is you want to really go through your house and look for things that could trigger your sensory system. So do you have a room where the lights are dimmer? There's a library of books. There's some nice fluffy carpet. It's a clean space. It's untouched. The room never is disturbed. It's not a place everybody, regularly goes to. It's one small dedicated space with a door that can close. In that dedicated space, if my clients ever, create that dedicated space, I often encourage them to go to places like Five Below or Dollar Tree, Dollar General, and just get a variety of things that are comforting. You could get, maybe a small coffee machine where you can make some tea, have your, nice and comfy and inviting cup, pillows, throws, blankets. Maybe you want a TV in there, a little small TV up on the wall where you can watch movies in a dim lit room, or if you like lots of light, that is okay too. I often suggest really looking around and asking, is this a noisy environment? Do we ever have any moments where there's quiet and there's calm and there's serenity? Or do we have an environment where the dogs are barking, kids are running through the house, dad's screaming, there's a TV on in the living room downstairs, there's a radio in that room over there. And we often live our lives this way, right, guys? Because I know, in my home, I have the radio on in the kitchen. Then I go in the living room, my mom's watching TV, my brother's down the hall talking to somebody on the phone. So it happens. But when there's been family trauma and there's been individual trauma, you really want to help the brain heal itself. And the best way to heal itself is to have an environment that caters to the brain's needs. We have, as an example of how this impacts us, we have an almond-sized structure in the middle of the brain. And I talk about this a lot on my channel. It is an almond-sized structure in the middle of the brain. It's around the limbic system, or the emotional piece of the brain, which is in the center of the brain. It's called the amygdala. And the amygdala really grabs on to emotional experiences. So let's say, for example, just so you can get a visualization of this, as a child, grandma would eat popcorn every night before bed. And you would go and spend the night with grandma a couple days a week. You remember hearing the popcorn pop. You remember smelling the butter and the salt. You remember grandma offering you popcorn. And then you remember the sounds in the environment. You remember what grandma looked like at the time. That is an emotional memory that the amygdala is cementing into your brain. It's almost seared onto the brain. It's very interesting. There's another structure next to that, next to the amygdala, and it's the hippocampus. And that is a part of the brain that gives you context. So the amygdala says, remember that good smelling popcorn? Remember Granny's hands? And she would swirl the bowl and there would be lots of popcorn in there and you couldn't wait to eat it. The hippocampus says, and by the way, you were wearing pink slippers. You were wearing, a nice little haircut. You loved how free your hair was. Grandma had a ring on her finger and a lot of bracelets. The hippocampus gives actual context and meaning to the amygdala. The amygdala says, I have these important memories and they are interconnected. So if I feel a threat in the environment where I'm feeling in danger now, or I'm feeling like I don't have, I'm feeling like I don't have safety, the amygdala turns on its own flashlight and it seeks the environment for threats, for things that can trigger fight or flight. And so when you are trying to heal trauma, it's important to understand my amygdala is bringing this memory back to my awareness. It's a bad situation. And I'm now having that experience. It's coming back into my mind. I remember the popcorn. I remember all of that. But I also remember the traumatic piece of this, which is that my grandmother died the day after. That's an example of that. So now your amygdala has a good memory, but it also has a traumatic memory. And that is not a good thing. So the amygdala says, let's search whatever environment we are in, and let's ensure that we totally avoid anything that can remind us of grandma and popping popcorn and the next day finding grandma deceased. So the amygdala has and plays a major role in trauma and in trauma recovery. So in an attempt to make the environment peaceful, we really have to keep in mind that the amygdala is on guard 24/7. And the hippocampus is on guard as well. It's providing that context to all those emotional memories that you have. And so the environment has to be calming, soothing, grounding. It has to be safe so that the brain can heal itself.
All right, what I'm getting from that is that we need to be mindful that a person's memories can be activated at any time. In addition to us knowing that, What are some effective strategies and tips for supporting a person who has experienced trauma, particularly in the role of a caregiver?
All right. So trauma is very complicated in the sense that the rate at which a person heals is different from the rate at which another person could heal. And there's differences in terms of age, culture, and intensity of the trauma. So some research suggests that the number one way to work through trauma is to, number one, address the trauma. It's better than internalizing it, but it has to be addressed when you're ready to address it. Because if you're attempting to address trauma, whether that's in therapy or just your own journaling, or maybe it's seeing a spiritual person, or following somebody online to get some kind of alternative forms of therapy and support, whatever the level of support or kind of support, it's important to go into this with an understanding that I have to be able to acknowledge the actual trauma. Once the trauma is acknowledged, then we have to walk through whether or not you can actually start implementing healing tools, because there's a big processing piece to healing trauma. And in my work with adults, children, and adolescents, I've seen that they really do heal very differently. Kids tend to be very, very much resilient. Adolescents can also be resilient if they are not putting up these really high defense walls. Because what I've seen working with adolescents who are trying to heal from trauma is they will often get angry and become really rebellious and really oppositional and sometimes defiant and engaging in negative behaviors. Or they will just shut down and not talk about it completely. Adults can do the same thing, but I think adults internalize trauma very differently. So maybe in your case, if you're suffering from trauma, you may just completely not go back to the place where a loved one was buried. You may refuse to drive past that place because it brings back too many medical trauma reminders and you don't want to deal with that. Or maybe you have a box of clothes of your husband because he passed away from cancer and the whole experience was traumatic. Maybe you have that box of clothes and it's really hard for you to say goodbye to it, or it's really hard for you to look at all those clothes in a box. So those are pieces of the puzzle that has to be managed so that we can then get to a place of success in healing. What I find most healing to my clients is a structured approach and an unstructured approach. I tend to incorporate cognitive behavior therapy that's trauma focused. And then I also incorporate existentialism. And it seems to really have supported my clients a great deal. It's amazing to see how building rapport with a client, so getting to know them and building a connection and laughing with them and sharing their hurts and sharing their joys, all of that leads to a place where clients or patients can say, I now trust you enough to walk through this scary thing with you. And so at that juncture, at that point, now we're inching into structured treatment. And that's where the worksheets come in and the homework and the journaling and really looking at cognitive behavior therapy, which is a therapeutic approach that identifies your thoughts. It identifies what your thought causes you to feel emotionally, and then what your feelings do to you to cause a particular behavior. So we jump into that and we start looking at, what does PTSD do to your mind? What are some of those thoughts that keeps you feeling negative, hurt, stuck? What visualizations or flashbacks are you getting as you are thinking about the loss, the trauma, the chronic stress? And once we move through that, then we can move on and we can start processing, well, what does this mean for you? And what does this mean for your family? And do you feel like you're on a journey? Which way are you going on this journey? Do you feel like you have some purpose and meaning? And that's the existential and spiritual piece of the puzzle. Once I start working with my clients using those two ways of thinking, I'll put it that way, I see improvement. I see success. I see stability. I see a little bit of acceptance coming in with my clients. And it's not, the healing of trauma is not really easy to identify. Sometimes I look and I say, wait a minute, we've been at this for about a year and I'm not seeing the progress. What is happening? And part of that is because the client is either struggling with thoughts that are keeping them stuck, or we're at a place where we're not really ready yet to address the deeper issue. But for the most part, and in the majority of sessions that I have with some of my clients who have trauma, they do heal, and they walk very slowly, and they walk very intently, and they're really trying to rebuild their heart and their mind and their soul so that they can continue forward. So for you, if you're dealing with a traumatic situation, the number one thing that I suggest is, and this is what I give my clients as well, in order to find that success and maintain that success, there has to be acceptance of the trauma and readiness to change, or to heal and move forward. There has to be recognition of what happened, even if that means talking about it again and again and again, because familiarity in some ways breeds comfort. Because the more you talk about it, the more you process it, the less painful it can be over time. So that has to be in there. And then there also has to be a commitment to move ahead and forward, even though it hurts, even though it's really traumatizing. There has to be a commitment no matter what. And once those three things enter into the mix, there are a lot of success that can be obtained there.
Finally, at Families for Depression Awareness, we always want to make sure that caregivers are taking care of themselves. Some people say that you need to take care of yourself so you can take care of others. Personally, I think you need to take care of yourself because you need to take care of yourself. And you deserve it. So what advice do you have for caregivers who are supporting someone who's dealing with PTSD, and how can they maintain their own well-being while they're providing care?
So the question was, how can a caregiver, which is often a family member, a parent, a spouse, sometimes even an adult child, how do we help them support the person who's struggling with trauma? And I think what's important for caregivers is, number one, understanding that that loved one, that son, daughter, that parent, that grandparent is suffering from something that is neurological. It's not just an emotional and psychological experience. It is not just, this happened in 2020. You should be over it by now. We need to move on. Caregivers really have to keep in mind that trauma impacts the entire system. It impacts the brain. It impacts how the body operates. It even impacts hormone levels, which can trigger weight gain, depression, anxiety, restlessness. It can even trigger other mental health conditions like ADHD or attention deficit disorder. It can trigger bipolar episodes. It could trigger psychosis. Trauma is complex. It's complex. So the more that a caregiver keeps that in the forefront of their mind, the easier it's going to be to support the loved one. The other piece of this is being patient. Being very patient. I'm like this with my clients. Sometimes I'm sitting and talking to them about the trauma that we talked about last week, and the trauma that we talked about the week before that, and the trauma that we also talked about the week before that. It's sometimes a sufferer's internalized desire, I'll put it that way, to continue to talk about the material. Why? Because it's something that has impacted them greatly, and they are trying to wrap their mind around this experience. And in order for them to really grasp what happens, because you can tell them what has happened, you can remind them this is what happened. You can even have them verbalize what has happened that's traumatic, and they are still holding on to the trauma, saying, I still don't understand what happened to me, and so it may take them a long time for that realization that there's trauma to just kind of seep in. And so as a caregiver, you really have to have more patience than a saint, and that is the hardest thing to deal with. I've been in that position with my family. My mom, back in February of this year, she had a stroke, a left hemispheric stroke, and it changed our lives. Thankfully, she's still here with us, but the entire experience was traumatic for myself and my siblings. And one of the biggest pieces of this was the unknown question of, will mom be okay? And thankfully, you can look at her, you can listen to her talk, you could see her walk with her walker. She looks like nothing ever happened. But one thing as a caregiver, because I'm taking care of her, my brothers are taking care of her when I'm working, one of the things I've learned as a caregiver to my mom and my late grandmother, because I also cared for my late grandmother. She died in 2020 with cardiac arrest. All of it was traumatizing, even for her, because she passed away at a time when COVID had hit us and we couldn't go in the hospital. We couldn't see her, and the list goes on. So both of those experiences were traumatic. But what I've learned in both cases as a caregiver is I'm going to be tired. So we need to validate that we're going to be tired. We are going to be irritable because we're not getting sleep. We're not resting. And we love and care about our loved one, and we want them to live and be safe and be healthy, right? So that's an emotional toll on us. But then we also have to have way more patience than you would possibly think, because that person is relying on us to carry them until they can get to a place where they can carry themselves. So validating yourself is important, looking at all the things that you're doing and just humbly applauding yourself, wow, that's a great job, Tamara. I'm so glad that you thought to buy a walker for your mother because the hospital didn't recommend one. Tamara, that was great that you fixed dinner after having about 20 clients in one day, So you really do have to validate yourself and then cling to someone. I have wonderful coworkers who I talk to, and my older brother can be comforting. My younger brother, not so much, but I love him. I love him anyway. Really grabbing on to those people that make you feel safe and can validate you. And they understand what you're going through. And in your mind, caregiving is tough when you're dealing with somebody that has a medical issue, when you're dealing with somebody that has a mental health concern. You really do have to keep yourself up, because if not, you're not going to be able to carry yourself and them. So I think also too, for caregivers, self-care and stress management has to be number one. It has to be number one. I noticed, excuse me, in caring for my mom, I couldn't just sit back and, stay up till 3 a.m. trying to help my mom, go to sleep for 2 hours, and get back up in the morning to go see 20 clients in one day. It was not working. I was really burning. What do they say? Burning both sides of the stick, something like that. You understand what I'm trying to say. But, burning two ends of the candle. I think that's what that meant. But you have to get rest, stress management, self-care, validation, support from as many people as you can. And lastly, for this part of the conversation is education. Psychoeducation is huge. When my mom was in the hospital in February, the doctors and the nurses can only do but so much. And then they kind of leave this big gap, okay, they took my mom to the hospital. They got her in bed. They gave her an EKG. They realized she had a left hemisphere stroke. She was sleeping, put on pain meds, and they wheeled her bed into the ICU, and they hooked her up to all these machines. And I remember walking in, I opened the doors, and I looked at my mom, who is the strongest woman in the world. And I just thought, Mom, what has happened? I mean, we didn't expect it. My siblings and I, But I sat there and I'm thinking, okay, they have given her blood pressure medication, they've given her water, they've offered her food, they've done everything. And I asked myself, sitting at the end of her bed, but why do I feel such a void? Well, because I was lacking the medical education and the know-how of how to care for my mom. I'm used to her caring for me and my siblings. I'm not used to the tables being turned, So it's important to get education. I sat at the end of her bed and I spent the night, whether the hospital staff wanted me to or not. I spent the night and I sat there and my mom was sleeping peacefully, and I did all the research I could think to research. I needed to become educated to what happened to her. And so I encourage caregivers to just continue to do the work, advocate for yourself, and get the education.
Thank you so much for your time. That's so much information for me and for our viewers. I'm grateful for you for sharing your expertise. And I just want to encourage people again to go to familyaware.org, where they can learn more about caregiving.